prevalence of suicide among young. So I invite Dr. Arun to talk on this rather important topic. Thank you.
Good afternoon. At first, I would like to thank MAPICON organizers for giving me a chance to speak on a pressing issue that affects our society profoundly, suicide among the youth. It's a topic that may be uncomfortable to talk upon, but it's crucial that we discuss it openly and honestly, because only then we can work together to prevent. Suicide is 100% preventable. Suicide is a global public health concern, and young people are particularly vulnerable in India, where we have a youth-rich population. The problem is especially acute. According to NCRB, suicide is a leading cause of death among young Indians aged 15 to 39 years. This statistic highlights the urgent need to address this issue in our country. The NCRB released its finding on suicide rates in our country, recorded a total of 1,64,033 suicides in 2021, representing a 7.2% increase compared to 2020. This marked the highest number of suicides ever reported since the NCRB began documenting such a data in 1967. In terms of suicide rates per lakh of population, India reported a rate of 12, indicating a 6.2% increase in 2021 compared to 2020. The states with highest number of reported suicides were Maharashtra, Tamil Nadu, Madhya Pradesh, West Bengal and Karnataka, collectively accounting for 50.4% of all suicides in the country. Family problems and illness emerged as the predominant causes of suicides as outlined in the report. Notably, the age groups of 18 to under 30 years and 30 to under 45 years comprised 34.5% and 31.7% of total suicides respectively, with a significant number of these individuals being students. In 2021, a staggering approximately 13,000 students lost their lives to suicide. The NCRB reports highlighted again family issues as a major factor in 33.6% of all suicide cases. Our neighboring state, Himachal Pradesh, witnessed a concerning rise in suicide with the 46.7% increase from 2019 to 2020. It ranks as the second leading cause of death among individuals 15 to 25 years with unfulfilled expectations and ambitions, leading to impulsive behaviors and self-harm. Drug-related issues and relationship problems were identified as other significant factors contributing to suicide. Furthermore, the report highlighted that self-harming behavior and suicide thoughts and attempts reached an all-time high, with the notable presence of engineers, doctors, and PhD students among those affected. In medical colleges, despite the presence of psychology and psychiatry departments, students often struggle to prioritize their physical and mental health due to demanding schedules, long shifts, and challenges of hostel life. The issue is exacerbated by the incidence of ragging in professional institutions, despite a Supreme Court ban on such practice. Reported suicide attempt figures in India may not be entirely accurate due to local police discretion influencing the classification of death as suicide or otherwise, despite the decriminalization of suicide under the Mental Health Care Act. Furthermore, a significant number of students hesitate to report suicide attempts due to the pervasive feeling of guilt, shame, and fear of social stigma. This underscores the urgent need for a more empathetic and stigma-free approach to mental health care, particularly among students. Alongside legal reforms, comprehensive awareness campaigns, robust mental health support system, and educational initiatives are imperative. Factors underlying student suicide in India: academic pressure, high expectations, competitions, lack of mental health support, stigma surrounding mental health, peer pressure, in-person or cyberbullying, relationship issues, economic factors, lack of coping skills, substance abuse, pressure to choose career path. Let me brief up with some predominant causes of suicide among youths. academic pressure. As you know, in India, pressure to perform well in board exams and entrance tests is immense, leading some to despair when they fall short of these expectations. Unemployment, high rates of youth unemployment in India can lead to feeling of hopelessness and financial instability. Arranged marriages, cultural norms still in India often lead to arranged marriages. When young people feel pressured into marriages, they are not ready for it. It can result in emotional distress and sometimes even suicide. Gender issues, gender discrimination and violence against women persist in many parts of India. Young women facing discrimination or violence may see suicide as their only escape from intolerable situations. Lack of mental health awareness. Stigma surrounding mental health is still widespread in India. Urban-rural divide. There is significant difference in availability of mental health resources and awareness between urban and rural areas. Now I am going to discuss some past incidents that have occurred in renowned institutions and cities. In the period since 2018, 33 students have tragically taken their own lives within the Indian Institute of Technologies. It's important to note that a higher proportion of self-harm cases occurs in the broader educational context in India. Suicide prevention should be integrated not only in these institutions but also within the families of teachers, non-teaching staff, and also associated stakeholders across the educational sector in India. Raising awareness and fostering a culture of mental health and well-being are essential for creating a safer environment for students. Moving further, let's talk about quota. In a tragic turn of events, 2 NEET aspirants have lost their lives to suicide in a single day in Kota, and a staggering total of 22 deaths in a year. And the same story was published in the Tribune with the headline of Kota deaths, collective efforts need of hour. And as per the opinion of Professor Dr. Vitull Gupta, which I totally agree, question is why Kota factory is in existence. I strongly feel that gradually over the years, classroom teaching has lost its importance and coaching culture has taken over because of increasing dependence on entrance exam. Moreover, rising aspiration, shrinking opportunities, neoliberal agenda, and more importantly, coaching culture and examination system has failed to judge the student real capabilities. Intelligence, innovation, analytic skills, knowledge, creativity, self-learning, and students' original or genuine quality or ability, but has increased rat race to clear entrance examination. Again, pressure of perfection. My colleague from South has written in the paper, over the past 3 years, more than 26,000 have committed suicide across India. Majority of students' suicides are caused by underlying suicide factors such as emotions, which can sometimes lead to mood swings. Influence of limbic system. The limbic system, the part of the brain associated with emotion and impulses, is in full gear during adolescence. This can result in teenagers making decisions based on the feelings and desires rather than well thought out plans. Peer pressure and social media. Teenagers are highly susceptible to peer pressure, which can be exacerbated by the influence of social media like platforms like Facebook, Instagram, etc. Copycat behavior. Adolescents often mimic the behaviors and attitudes of their peers. Emotion perceptions. Teenagers may perceive their emotions as being more permanent and significant than they actually are. performance and perfection. Teenagers face increasing demand to perform well academically, athletically, socially. This pressure to excel can lead to stress and anxiety. Difficulty with future thinking. This can sometimes lead to feeling of hopelessness because they may not see their path clear ahead or understand how their current choices can affect their long-term goal. In summary, adolescence is a period of immense change both in the brain and in emotional development. It's marked by increased susceptibility to the peer influences, challenges with managing emotions, and a growing awareness of societal expectations. Understanding these factors is crucial for supporting and guiding teenagers through these transformative phases of life. Now, media plays a very important role in suicide prevention and suicide reporting. The negative role of media in suicide reporting can have serious consequences. Contagion effect. Irresponsible reporting of suicide can lead to a contagion effect, wherever vulnerable individuals are more likely to attempt suicide or complete suicide after being exposed to coverage, referred to as copycat suicide. Glamorization, graphic or romanticized portrayal of suicide in media can glamorize the act, making it seem like a valid solution to a problem or a way to gain attention and sympathy. Detailed method. Describing specific suicide method in detail can inadvertently provide individuals with information they may use to harm themselves, especially if they are already in a vulnerable stage. Stigmatization, misrepresenting or stigmatization suicide in media coverage can deter individuals for seeking help or disclosing their own struggles due to fear of judgments. Simplification of complex issues. Media often oversimplifies the causes of suicide, attributing it to a single factor when in reality it is a complex interplay of multiple factors such as mental health issues, social pressures, and life circumstances. Sensational headline and images can grab attention but may not accurately represent the complexities of suicide or contribute to a better understanding of the issue. Lack of prevention information. Media reports often focus on event itself, providing limited information about mental health resources. Celebrity suicide. Highly publicized suicide of celebrities attract extensive media coverage, like represents the suicide of celebrity Sushant Singh Rajput. Inaccurate reporting, misreporting facts, failing to adhere to responsible reporting guidelines. Ethical concern. In summary, the negative role of media in suicide reporting can contribute to the contagion effect, stigmatization, and increased risk of suicide among vulnerable individuals. It is essential for media outlets to adopt responsible reporting practices and collaborate with mental health experts to address this critical public health issue responsibly and ethically. And in assessment of suicidal risk, there are 3 stages of suicide: ideation, threatening, and attempting. And every person who attempts a suicide always gives a clue. It can be verbal, situational, or behavioral. And behavioral clues are giving away his valuable possessions, writing suicidal note, new purchase of weapons, non-compliant with treatment, if he is on a psychiatric treatment, risk-taking behavior. Verbal clues: I can't go anymore. I wish I was never born. I wish I were dead. I won't need this anymore. My parents won't have to worry about me anymore. Everyone would be better off. I was dead. Nobody cared if I live or die. Situational clue: prior suicidal attempt, serious illness, rapid decline in functioning, social isolation. Next, suicidal inquiry. This is detailed psychiatric evaluation. It is vital to ask about suicidal risk and document the answers. The key is to ask questions in a clear, empathetic, and non-judgmental way. Instead of saying, "You are not thinking of suicide, are you?" It's better to ask, "Have you ever felt so low that you wished you were not there?" For patients dealing with issues like psychosis or depression, we should dig deeper into their feelings and thoughts to understand their emotional well-being better. This helps us provide the right support and care. When a patient denies having suicidal thought, we should consider whether they might be saying this because they think it's what we want to hear. If a doctor is seriously concerned that patient may not be telling the whole truth about their suicidal thoughts, they might need to talk to the patient's family, even without the patient's permission, to get a better understanding of the situation. In cases where a doctor believes the patient needs immediate hospitalization, it is crucial to have a responsible adult like a nurse, the patient's spouse, or a parent stay with the patient until they are admitted to ensure their safety. Our top priority is the patient's well-being, and taking these steps is essential to keep them safe and also to protect the doctor from potential legal issues, self-harm, or suicide were to occur. Factors that safeguard against suicide. Restricted access to lethal means. Reducing access to lethal methods of self-harm such as firearms, pesticides or medication, healthy lifestyle choices, positive media and role models, empowerment, life skill trainings, sense of belongings. Prevention, risk assessment, diagnosis of suicidal behavior are key to decreasing suicidal rates. Universal intervention, again, restricting access to means, media strategies for better recording, suicide awareness campaigning, selective interventions, pharmacological interventions, general practitioner educational programs, development of treatment guidelines, indicating interventions or psychological interventions, social approaches, crisis service helplines. I am not going to detail. Intervention for suicidal ideation and suicidal behavior. In psychosocial intervention of cognitive behavioral therapies, dialectical behavior therapies, and pharmacological interventions are lithium, ketamine, SSRIs. Now, this is very important part of this seminar. Preventing teen suicide, a guide for parents. Teen suicide is a deeply distressing issue, but it is preventable. Vigilance and awareness. Stay vigilant by actively monitoring your teens' peer group and their online activities, including social media. Quality time and engagement. Spend quality time with your teen and engage in their social and sports activities, showing support for their interests. Unconditional love and acceptance. Tell your teenagers that you love them, and not just with words, but through actions and gestures that demonstrate your affection. Balanced expectations. Encourage them to pursue their passions and interests. Communication is key. Maintain open and honest communication with your teen. Encourage them to talk about their thoughts and emotions. Setting boundaries. Be clear and consistent when setting boundaries, especially concerning drugs and alcohol use. Access to mental health services. Recognize the signs of emotional distress and mental health issues in your teenagers. By following these practices, you can create a nurturing and supportive environment for your teenager, significantly reducing their risk of succumbing to the pressure and challenges that can lead to teen suicide. Remember, your involvement, understanding, and love can make a profound difference in their life and well-being. Key components for ideal educational environment. Optimal learning conditions. Ensuring a conducive teaching learning environment where students are motivated, engaged, and supported in their educational journey. Fair and effective assessment. Implementing assessment systems that are fair, transparent, and geared toward gauging true understanding rather than rote memorization. Equity and inclusion. Granting that every student is treated equitably, irrespective of background or circumstances, fostering an inclusive community of learners. Diverse opportunities. Providing a wide array of opportunities both in academics and co-curricular activities to help students discover their talents and passions. Real-world connections. Linking education with society and ecology through immersive experiences such as field training, job placements, educational tours, and summer internships. Student service centers. Establishment of student service centers across institutions. This 5T model for mental health education in schools. Talking about mental health, providing appropriate training for teachers and staff, incorporating mental health into teaching, providing helpful tools for students, taking care of teachers. In embracing these principles, we can lay the foundation for an educational system that not only impart knowledge but also equips students with skills, values, experiences they need to thrive in an ever-changing world. India has introduced its first National Suicide Prevention Helpline, KIRN, under the purview of Ministry of Social Justice and Empowerment. Accessible via the toll-free helpline number operates around the clock. Additionally, on World Mental Health Day last year, India launched the Tele-Manas program, officially known as National Tele-Mental Health Program. This ambitious initiative is designed to extend mental health services to individuals nationwide. Tele-Manas endeavors to establish tele-mental health facilities in each of the India state and union territories. Decriminalizing attempted suicide. Prior to the enactment of Mental Health Care Act in 2017, attempted suicide was deemed a punishable offence under Section 309 of Indian Penal Code. However, the Mental Health Care Act effectively decriminalized suicide by introducing a significant exception to Section 309. Now, any person who attempts to commit suicide shall be presumed to have severe stress and shall not be tried and punished under the said code. At the end, I would like to conclude with that the suicide among youth is a complex issue with multifaceted causes. However, by raising awareness, providing mental health support, and implementing prevention strategies, we can work toward reducing its incidence. Let's create a society where young people feel understood, supported, and valued, ensuring that they can face life's challenges with hope and resilience. Remember, if you or someone you know is struggling with the thoughts of suicide, please seek help from mental health professional or a helpline. You are not alone and there is a help available. Thank you.
Thank you, sir. For the next talk, I would like to invite Dr. Madan Mohan.